Amen.
So yes, please let me know you can hear me with emojis. Shout with emojis. Okay, thank you. So yes, we will just start. Today we are all here, and then the meaning, do I have an infection, or does this one, please, I'm coming, hold on a minute. Do I have a vaginal infection? This is what many women battle with, because as a woman, sometimes you kind of have you kind of see some fluid in your pants. Sorry, excuse me. So you tend to ask, does this mean that I have an infection? Because people say that every time you see fluid in your pants, or maybe you see a discharge, that means you have white. So is this true? Others will ask this one. So today we are going to dive in and learn more about it, and then to know that is this type of fluid an infection, or this is normal, or what do I have to do in order
na ebia so wɔ land wɔ ne kurom a ɔsi
Hello, please, can I be
Hello.
heard?
Yes, please.
Hello, everyone. Okay, thank you. Sorry, it's raining here, that's why. So let me move on. Our first speaker, she's in the person of Priscilla Daniel Amegashi. Hello, Dr. Beneda. Can you please add Mary Edubi to as a co-host? I'm trying to share my screen. Okay, thank you. Please, can you see my screen?
Yes, please, I can.
I hope everyone can see it now. So our first speaker is in the person of Priscilla Daniel Amageshi. She is a PharmD student and then passionate about female reproductive health advocate. She is also passionate about adolescent female reproductive health and works to empower young women through education, mentorship, and access to accurate, relevant health information. So by merging pharmaceutical care with health advocacy, Priscilla is building a voice that champions informed, confident decision-making among young women. Aside academics and advocacy, she manages her jewelry business known as Vaginal Jewelry, a brand through which she expresses her love for fashion and styling. Her work reflects a unique blend of science, advocacy, and creativity, positioning her as a rising voice in youth health empowerment. So yes, Priscilla is a PharmD student, and then she's also is the CEO of McDonald Jewelry. So if you're also into fashion, you can contact her after the session. So with that, I will introduce Priscilla to start. Priscilla, you have the floor.
Okay, thank you. Thank you so much, Mary. Thank you all for joining our meeting this evening. Before I start, I'd just like to say thank you to Dr. Benedicta for the opportunity and the RTC Foundation for the opportunity. Okay, so as a women's reproductive health advocate, this is a topic I'm so passionate about, and today I'm excited to be part of the people that are leading the conversation in this aspect of women's reproductive health. So before I start, if you're excited, please let me see your reactions in the comments. If you're excited to have this conversation, these are my ladies here. I would like to see your reactions in the comments. Yes, and this conversation will not be just for we the ladies. The men are also needed on board because this education is as important to women as it is important to men as well. So today my question is simple, and I'd like you to leave your answer in the chat box. Do you think every infection is sexually transmitted? Do you really believe that every infection, every vaginal infection is sexually transmitted? I'd like to see your response before I go on. Okay, Mamiesi says no. All right. Can I get more responses? Winifred said no. Engineer Pell said no. Okay. I like those responses I'm getting so far. Hey, I'm not hearing from the men. Are they here? Mm. This is to also say that if the question can also be put in this way: if you are not sexually active, can you have a vaginal infection? Yes, that's another way you can put this question. Emanuela says no. Okay, thank you guys so much for the response. Okay, so today we'll be talking about an aspect of women's reproductive health, which is vaginal health as a whole. So we are talking about vaginal infection in terms of discharge, itching, and rashes. As a woman, I know how frustrating it can get when you have a symptom down there and you cannot explain what's going on with you. Maybe you have a discharge, the color is off, not the usual. Maybe there's some odor down there, it itches, and you don't know what to do. It gets so frustrating. And really, what the problem is that the way these symptoms present, they are not always clear as to whether it's an infection or not, unless of course it has progressed or it's in the worst state. But sometimes it's confusing to tell, and sometimes you don't know what is normal and what is not. So I hope that by the end of this presentation with my co-speaker, you come to understand what vaginal infection is, what is normal discharge, what is not. And then if you have an infection, what is the next step of action? What should you do? Which is so important. Yes. Mary, please can change the slide. Okay. So from my introduction, you can tell that vaginal infection is one of the leading causes of medical problems in women as a whole. It affects them not only physically, or not only their physical health, but a woman who has an infection, a vaginal infection, is going to affect her quality of life, how well she's doing at work, even how she interacts with people. Her self-esteem is even affected in the long run. So, this is a crucial matter. And like I mentioned before, sometimes the knowledge is just not there. You are confused. You are seeing this discharge. You don't know whether it is normal or not. You don't know whether what you are seeing is what it should be. Should you wait to see the worst before you take action? That is why we are having this conversation today. So go with me, stay with me as we move on. Next slide, please. Okay. So vaginal discharge is a fluid that is produced naturally from the vagina. So God in his own wisdom has created us, and with our reproductive system, he has designed that this fluid is produced. This fluid is made up of cervical mucus. It's made up of dead skin cells. It's made up of microorganisms that are resident in the vagina. So the discharge that is coming out is not bad. It's actually the body's own way of keeping a balance. So it is taking out dead skin cells. It is keeping the vagina moist, and it's also maintaining a healthy balance in that it is taking out some of the overgrowth of microorganisms that are in there, and leaving the right amount, if for want of a better word, leaving the right amount there that will protect the place so that nothing falls out of balance and then ends you up having all those problems. It is also worth noting that the kind of discharge that you have are affected by hormones. So you will see that at different stages in your menstrual cycle, your discharge will be changing. Usually, not to go ahead of myself, I'll be talking about this more, but you will see that in the ovulation stage, the thickness and the consistency of your discharge is different as you progress in the menstrual cycle. Your vaginal discharge, sorry, is going to look different. This is because there are different hormones that are affecting the way they look. So while I'm talking about how normal this is and how the body is just trying to maintain balance down there, sometimes this discharge is a signal that there's an infection going on. Next slide, please. So in Ghana, quite a number of vaginal discharges. Whenever a woman sees vaginal discharge, most of the time they refer to it as white. Yes. So at this point, if you've ever heard of white, if your mommy ever told you what white is, just drop it in the comments. What you know? Have you ever heard of white? If you have, just say yes in the comments. And then what do you know about white? So just to put in a bit of my story. So growing up, anytime I would ask for a sweet, an ice cream, my mother would say no. Or even when I'm going to school, she would want me not to buy anything with my any sweets with my money because she would say that ubenya white, those things, like it was more like a threat. And then she will also say that if I get white, she'll make me sit in warm water. So it's either you buy those seeds and then you come and face the consequences, or yes, you get where I'm going with it. And most of us have actually heard these things. Ubenya white to sofina udino. So at the end, I'm sorry for those who don't understand tree. All I'm trying to say is that our mothers would usually refer to these vaginal discharges, unusual vaginal discharges, as white. But most of the time, what they are trying to communicate is actually vaginal candidiasis. Even though the term white will refer to a broad number of vaginal infections, most of the time the presentations that they complain of is actually vaginal candidiasis, which is the most common form of vaginal infection. So in this, there's a change in color. It will still be white, but not like what you have in your normal when you have your normal discharge coming out. You realize the consistency, the stretchiness of your discharge, how thick how thick it is, and all of that is going to change. And then when the smell comes in, even the next person or whoever you are closely related to will start to perceive it. And sometimes they will tell you Yes, if they are quite close, they're able to communicate to you that I've been perceiving this kind of odor from you and all of that. Yes. So now we know what white is. Next slide, please. Okay. So let's just explain a bit about the physiology, how it looks in our reproductive system in general before we move on to the infections into details. So your reproductive organ, your vagina, is just the outside of it. But when you go a bit further, the vagina is lined with something called your vaginal flora. This flora actually houses a number of microorganisms. So this vaginal flora has healthy bacteria in there that are actually supposed to guard against infectious bacteria from taking over the place. So these good bacteria, for want of a better word, yes, good bacteria are there. They act, you may see them as your personal bouncer or your soldier even. So they are there to make sure that other invading infection causing bacteria do not get in and take over the place. So yes, that is the main makeup of our vaginal our reproductive organ down there. Also, apart from these good bacteria that are there, there are a number of potential infection causing bacteria that are also there. Even though they are not, should I say, the the good bacteria, because they have the potential to cause infection. They are there in small amounts. But at the end of the day, they do not cause any harm as as they are in that at that level. So what the good bacteria will do is that as they are there, they are competing with these other small amounts of the potential infection causing bacteria for nutrients and then space. But because the good bacteria are larger in number than those, they always outcompete them. At the end of the day, those bacteria that have the potential to cause infection, they die out, and that is how they come out through our discharges. Also, the normal vaginal flora has a certain pH, it is acidic, and this helps to prevent the growth of harmful germs and maintains a healthy balance down there. Next slide, please. Okay. So what you see in this picture is what your normal discharge would look like. So even in between on the first the top of the picture, you see someone has a fluid or a substance in between the fingers. That would be our normal for the purpose of this presentation. It will be our normal vaginal discharge. If you look at the left finger, you realize that the discharge is not as clear or egg white as on the other side. Yes. So usually this is how it will look. So usually during your ovulation, because estrogen levels are high, they are responsible for producing these clear egg-like discharges, and this is normal. But as you progress after ovulation, you realize that it becomes a bit whiter than you would have in your ovulation stage. This is also normal. But the thing with the white discharges is quite tricky because vaginal candidiasis also causes the white or milky discharges from, like, it causes that. So when you have this milky white discharge coming out, sometimes it's difficult to tell whether you have an infection or it is just the normal one. So usually you will see it's not so different from what you have, the very clear stretchy one. It's just a bit tinted white, not very milky. This picture is not doing justice, but I hope you can follow what I'm trying to communicate here. So another thing I'd like to mention is you should know yourself. For me, I know how my discharge will look when I'm ovulating. I know how it changes as I progress. So you would want to study your body so that whenever there's a change, whenever something is going wrong, you'll be able to pick it up as soon as possible and take action. Yes. Next slide, please. So let's go into the mechanism of how these infections come about. So I explained that the vagina itself has been designed in such a way that it is in a healthy balance. But if anything causes the place to go out of balance, in any way, then this is how your infection cascade will start. So first of all, I mentioned that there are small amounts of potential infection-causing bacteria down there with the healthy ones. So if anything happens that will cause any effect, that will cause the good bacteria down there to reduce in number, these potential infection-causing bacteria will take over, outgrow in number, and that is when you start having these uncomfortable effects at the end of the day. Aside the other resident organisms causing infection, you also have the invasion of foreign microorganisms. So these are not actually there in the vaginal flora at any point in time. But once this balance has been lost, they come in and then they also take over the place, causing these uncomfortable side effects you are going to be seeing, this uncomfortable discharges, the foul smell, and all of that they are going to be experiencing. So it's important to note that some of these infections, they are caused by certain organisms that are residents there, but they have the potential to cause infection when they outgrow in number. And then some of the discharges or the infection will come from organisms from outside that have now been introduced into the area. Next slide, please. Yes. So what are some of the things that will predispose you to getting a vaginal infection, or what will cause the balance down there to fall out of place and then help help bacteria, the infection causing bacteria to thrive? Poor hygiene is one big one. Most of the time you wear tight panties. These days you wear a lot of clothing. You have your panties, you have your underwear. Sometimes you even have other things down before you wear your jeans. A lot of things. You have a lot of clothing piled on. There is heat, sweat, and all these things create a conducive environment for bacteria to thrive. Yes. So these factors can predispose you to certain infections. And at the end of the day, the effects are uncomfortable. Yes. We also talk about antibiotic use. Like I said, in your vaginal flora, you have good bacteria there. But at the end of the day, they are bacteria. And what do antibiotics do? They fight against bacteria. So irrespective of the fact that they are good bacteria, your antibiotic does not know that. So at the end of the day, it's going to clear your good bacteria, it's going to clear the bad ones. But once your good bacteria reduce in number, know that the bad ones will take over very quickly. They outgrow in number, they colonize the whole area, and then they start giving you the reaction, the effect that you see. Yes. Another factor that predisposes you to vaginal infection is high blood glucose. Yes, back to my story where mommy will say, sweet no, white no. Yes. If you eat too much sweet, you get candidiasis, for those of us who don't understand chi. So usually they may not explain it in the best way possible, but this is what they mean. So when your blood sugar levels are high, you realize that whatever goes into your blood will one way or the other end up in your body fluid, your biological fluid, and your vaginal area, the cervical mucus, and all of the fluids that are there are also biological samples. So if you have too much sugar in your blood, it's most likely, or yes, it's surely going to end up in your discharge. It's going to end up in the environment down there. So these infectious bacteria will sense this and they feed on it. They feed on glucose. So once it is high, they are feeding on it, they are growing, then they become more, then they take over. They throw the landlord, the good ones, out of their way. They outgrow, then there's a whole problem. Also, hormonal changes. I've already mentioned how hormonal changes will affect the kind of discharge that you produce. But it is worth noting that hormones like estrogen are able to increase the storage of glucose in the form of glycogen. And at the end of the day, high blood sugar, glucose is basically blood sugar, basically sugar. So when it is high, you see how your infectious bacteria are going to thrive. Contraceptives are made up of progesterone, another hormone that promotes the growth of these organisms. It is a hormone that actually suppresses your immune system. If your immune system is down, means your defense is down as well. So these bacteria, infection-causing bacteria, are going to take over and then cause havoc. Also, weakened immune system. So like I mentioned just above here, when your immune system is down, it means um you don't have a defense, you don't have a barrier, you don't have your soldiers up and doing. So it means whatever comes there can actually cause so much effect, so much negative effect at the place. So an infection like HIV, your immune system is down. So these organisms, the potential disease causing organism, potential infection causing organisms, they are opportunistic. So once they find that your um your system is left unchecked or the good bacteria are not as much as they should, they will take over, throw them out, and then completely colonize the area. And this effect of the infection causing bacteria go far beyond just what you see at the outside. They can travel as high to the um, upper part of your reproductive organs and then cause more harm. Yes. Next slide, please. Okay. So now let's look at how vaginal infection would typically present. One of the things you're going to see is the discharge, change in the discharge. So you see a change in color. As we go on, I will speak about how the different infections cause changes in color and the color that are associated with particular infections. So you see a change in color that could be a sign that you have an infection or not. Strong or foul smell. For most people with this, they pick up that they have an infection. Once the place actually smelling bad, they believe that okay, this one it could be an infection. But what is the next step of action? Usually, it is what you do when you find out that you have an infection that changes the whole story. Yes, so we'll be talking about all of that later. And then sometimes you realize that there's a thick head-like discharge there. This one is usually indicative of yeast infection, candidiasis, like I mentioned earlier. Sometimes too, the infection will cause your discharge to become watery and then it itches a lot, causes irritation and redness in the area. Next slide, please. Aside the effects, aside the effect of vaginal infection on the discharge, it also affects the the mucosa, the lining of your vagina in all. So because the vagina is a sensitive organ and is easily irritated, the small introduction of these infection-causing bacteria can cause irritation, redness, and swelling in the area. Sometimes can cause rashes. And if this is left unchecked, the infection will travel higher up in the vagina, in the genital tract and cause more harm. These are especially seen in sexually transmitted infections. Yes, vaginal infections that have to do with sexual transmission. These are very classical of them, but it can also occur in vaginal candidiasis as well. Next slide, please. Okay, so now let's talk about the most common cause of vaginal infection, especially in our setting, Ghana. So it is one of the most common causes of vaginal infection. I've already stated that, which results in the overgrowth of candida bacteria resident in the vagina. So candida is one of the organisms that are there. They have the potential to cause infection, but in the right amount, nothing happens. Once the balance is thrown off and your good bacteria are down, candida is going to take advantage of that, multiply in their numbers, and now they will actually cause these effects that we do not want to see. Next slide, please. Okay. So in the picture here, you see how the discharge will look like. Usually it is white or pale yellow. Yes, like cheese. and it will have some lumps inside. Unlike what you have in your normal discharge, which is also white, for this you notice some lumps in there. And then sometimes in some people it will cause itching and swelling. At this point, I would like to emphasize on the fact that because most of us are different in our physiology, irrespective of the fact that we are all women experiencing this, your your experience may be different from another person. Someone might have an infection, the same infection as you, but they may not have the itching and the irritation down there, or they may be even be asymptomatic. But that doesn't mean that the infection has doesn't have the ability to cause all these problems that I have mentioned earlier. It's just because for some people they react differently to how these organisms take over their vaginal tract. Yes. Next slide, please. Okay, so let's move on to talk about other vaginal infections. Most of us have heard about bacterial vaginosis. So this is also caused by a bacteria that is sometimes isolated from the vagina. So even though it is a disease, even though it's not part of the good bacteria, it's one of the microorganisms that are resident in the vaginal flora. So when if there's a disruption in the healthy balance in the vagina, the bacteria that causes bacterial vaginosis takes over. And usually what you see is a thin grayish white discharge with fishy odor. This is so classical of this infection, the fishy odor. In Chi, we say that yes. So usually people pick this up, but like I keep saying, they pick it up, but the next step of action is what actually lands us where we see ourselves. You see, the AMR, antimicrobial resistance, and all of that. Yes. So with this one, people actually notice and then they take steps. So by the end of this presentation, you know how to better deal with this. Yes. Yes. So and like I said, it will cause itching in some people or burning. But in some people, they may not have all of that. All they'll get is the fishy odor and then the change in color of their vaginal discharge. Another vaginal infection I'll talk about is chlamydia. This one is sexually transmitted. So usually it will cause your discharge to look pale yellow with you experience some painful urination or pain during sex. For this particular infection, a number of women have been found to be asymptomatic, meaning that when they have this infection, they may not show any symptoms until it gets to the worst of the worst. That is why it's actually scary. Yes. So if you get in contact with this infection and you're not experiencing the painful urination, pain during sex, and you're still seeing the color and everything, you're supposed to take action. You're supposed to actually go and seek medical care because this infection can travel to other parts of your genital tract and cause more harm than you would think. Yes. Next slide, please. Okay. The next vaginal infection I'll talk about is gonorrhea. So this one is more popular among males because they present with symptoms. Women get this too, but because again, like in the chlamydia, they are asymptomatic. You would think nothing is happening, but they actually have the infection. That's why it's always important to seek medical advice, know what's going on. Don't just sit and see if it will go away. You take you should take steps towards knowing what's happening down there. So with gonorrhea, it is also sexually transmitted. It will result in yellow to greenish discharge. It will cause pain in urination and lower abdominal pain. Lower abdominal pain is a classical sign that your infection is traveling higher up into the upper part of your reproductive system. Then we have trichomoniasis. With this, your discharge is going to look frothy, meaning that it will have some bubbles in there like foam, not foam per se, but you have some bubbles in your discharge. It will look greenish yellow and will have a foul smell. This in some people will sometimes present with itching, redness, swelling of the outer part of the vagina, and then they may have burning sensation when they are urinating or even during sex. Yes. Okay, next slide, please. Okay. So aside the vaginal infection that are caused by bacteria or the growth of microorganisms, there are other non-infectious causes. These may not directly introduce microorganisms into your reproductive organ, but it's going to create the atmosphere for for these microorganisms, this infection causing microorganisms to thrive and do well. Yes. So one of them is wearing tight underwear, like I mentioned earlier. The heat, the sweat, and everything is going to cause the environment, that place, to be good for bacteria to actually multiply. And another thing is wearing underwear that is not very dry. So here you would like to dry your underwear in the sun, dry it out for it to be dry before you use it. Yes, don't use underwear that is moist. And in as much as the place is already moist because of the discharge and everything, um do all you can to keep the place dry. Yes, so don't introduce water. There is already moisture in there to keep the whole balance and all, but don't introduce moisture. So when you finish taking your bath, clean the place with a clean towel and everything. Keep the place dry so that these microorganisms will not take advantage of this to multiply. Then the use of certain harsh detergents and soap. Yes, some of these soap contain very harsh chemicals that are going to break down your good bacteria yet again and cause your the infection causing bacteria to multiply and then cause these negative effects that we are seeing. Yes, so this last point, the use of vaginal sprays, douches, and vaginal washes, it has become sort of like a trend in our time. I can talk about this all day. Nowadays, you go to Snapchat and you see these everywhere. Douches, the sprays, the feminine washes, and now there's something they call, is it yoni something? So many products. Some of these things, we don't even know the chemical consequence in there. You don't know what you're introducing into your reproductive organ. And it's important to know that, like I explained, looking at how your vaginal flora and everything has been designed, your vagina doesn't need your help to keep the place clean. It doesn't. You don't have to do anything unless you have an infection that needs to be treated. You don't have a part to play in keeping balance. Some people, they don't even have an infection, but for those of us who don't understand tree, they want the place to smell nice, so they go in for all these sprays, and you don't need all of that. Your vagina is good as it is. It has a peculiar smell. It has a peculiar, however it is, it's the way it's supposed to be. You don't need any spray for the place to smell nice. You don't need any spray. Some people, okay, so when I went to SHS, people actually pack antibiotics to school. I know sometimes the sanitation and everything is bad in the washrooms, but you don't need to sort of guard yourself against these things. Take antibiotics that you do not need just to sort of arm yourself against any um, infection while it hasn't even occurred. You don't do that. That is wrong. And with the things that are going around, the douches that they are selling on these platforms, most of the people that are advertising and influencing these things, they don't even know the consequence. They're just making their money. You do not need them. You do not need them. Your vagina has the everything it needs to take care of itself. Just do what you have to do, keep the place clean, and you'll be okay. You don't need to introduce anything to make the place smell nicer, look better. I don't know. Eat well, take in a lot of water. That is all, really. That is all you have to do. Yes. Next slide, please. Okay. So, in the course of my presentation, I was mentioning some of the complications as I was going on. So, when some of these infections are left untreated, or you use the wrong antibiotics to treat, or you treat them in the wrong way, it's going to have certain effects on you. One of them is recurrent infection. In in this advent era where we have so much antimicrobial resistance happening, you can't afford to just take any antibiotic just because you are seeing a discharge that is unusual. What you want to do is see a health professional. You cannot just take anything at all because you want to treat. What you are causing there is the ability for these organisms to get used to the product you are putting in your body. Though it is not effective against that bacteria, you're introducing the bacteria there to the antibiotic. So the next time they come, they are used to this particular antibiotic. They build themselves up, they come better armed. And if you use this antibiotic when you need it, it will not work because now they know how it is, they know how to work their way around it. And this is the problem that we have when it comes to antimicrobial resistance. Also, another complication is the spread. I've said this over and over that when these infections, you do not treat them or you treat them the wrong way, they will travel up. They will not stay localized at the outer parts as you see it. They will go up into your organs. You're talking about your ovaries, your fallopian tube, your uterus. These are organs that these are places that house if you are going to if you want to get pregnant, these are places that are going to have house your baby and all of that. These are very very delicate organs. So you don't want any infection traveling to that area because the the consequences might be dire. Yes. Another complication is infertility, like I mentioned with my previous point. If you have your infections traveling up there, then if the bacteria will get there, they're going to cause a lot of distraction to the organs up there. Also, you have the risk of getting STIs. Yes, because if you leave these infections untreated, it means that your defenses again they are down. So any STI at all, they're able to penetrate your barriers and then take over the whole place and even enter your bloodstream. Yes. So now let's next slide, please. Okay. Okay. So now let's debunk some myths. When I started, I asked the question: Is every vaginal infection an STI? Most of you said no, which is very good because like from what all that I have said so far, some of these vaginal infections come from an overgrowth of bacteria that is in there or the introduction of the bacteria from the outside, but it doesn't have to come through sexual contact. Yes. And then with the herbal treatment, again, it is not the cure. It is not what you need when you realize that there's something unusual going on. These products are not verified and tested. Most of them they come with a number of chemicals. Yes, they are not isolated in one. They do not, the people that are selling them, they just talk a lot, explain a lot, especially on the buses. They will say so much for you to believe. And you see, when you have these infections, you want to do you want to do anything you can to get rid of it. So that's how they get you. They know that you need it. Yes. And these people they can talk, they can really vibe you. They will say all that you need to hear. But keep at the back of your mind, the person giving you that herbal product, they do not know all the chemical constituents, the herbal constituents that are in just this one product. Sometimes it is a lot of things, and at the end of the day, it may look like your symptoms. It may look like it is treating it, but it's actually causing more harm. So let's stay away from these herbal mixtures and all of those things they are advertising. Yeah. Next slide, please. Yes. So, what are the dangers of self-medication? After you realize that this is what you are, this is what you are experiencing, and then you decide to take care of it your own way without seeking medical care, it's going to cause a lot of harm, like the wrong choice of medication I mentioned earlier about the problem of antimicrobial resistance. You don't want to add this to your problem. Yes. So don't self-medicate. And I've already mentioned what the abuse of antibiotics can do to your normal flora, disrupting the place and then causing more infection. And then some of these harsh methods with heat and herbal preparation only worsen the infection. Like I mentioned, there's this one, forgotten the name. I think it's Yoni something. So what they do is pour herbal product in warm water, then you be made to sit on it, something for some, I don't know. But all I'm trying to put across is that some of these things are actually harsh. After what I've explained about how your vaginal flora looks, you don't want heat going there because some of these microorganisms, the good microorganisms, they'll be broken down by heat, obviously. Yes, so you don't want to use all those, and then the herbal preparations that are put in this water, the chemicals are going to come through the vapor into your vagina. We don't even know the chemicals that are in it. We don't even know the consequence of it at the end of the day. So you don't know whether you're doing harm to yourself or good. So just stay away from them. Do not patronize these things. And then what some of these products will do is that they will mask the symptoms. So it will look like your infection is being treated. But no, it's not being treated. It will just mask what you are seeing on the outside. But the real work is happening behind the scenes. The infection is going further up into your reproductive organ. And we know the consequences of that. Yes. Next slide, please. Okay. Okay, so please, at this juncture, I'll hand over to my co-speaker to continue from here. Thank you so much for your audience.
Thank you very, very much, Priscilla. You really, really done well. So yes, we are facing on my people. So now you know that poor hygiene can put you at risk, and also wearing those tight leggings, especially when you're going to bed. This one, I remember we learned it during our open convo. So yes, we are getting our answers. I hope you are learning because me, I'm learning a lot. So at this juncture, I will open the floor for one or two questions so that our next speaker will continue. Just one or two. Kindly raise your hand if you have a question or type it in the chat box. As we are waiting for a question, kindly give a round of applause to Prince like he has really, really done well. My people, let's show love because he has really, really done well. In the absence of that, I will then introduce the next. Our next speaker is in the person of Miss Betty Efanam Gable, and she is a seasoned public health nurse with over 100 years of service. And yes, she is the founder of She Cares Foundation, and that's an organization that's committed to adolescent health well-being. So yes, today you know our people, we are really supporting bodies. So yes, beyond her nursing practice, she is passionate advocate for maternal and child health, menstrual hygiene, and youth empowerment. She serves with the Youth Model Parliament for Infant constituency and has led several impactful initiatives, including health outreach programs, vaccination campaigns, and adolescent health advocacy. So yes, Miss Efonam is over here to share her knowledge with us. With a round of applause of emojis, let's welcome Miss Efonam.
Okay. Good evening, everyone. So I'm taking from the safe, and my name is Betty Etanamivo, a public health nurse serving at Infantima Municipality. So I'm taking from the safe and effective management. We are to visit the clinic for tests or regular checkups When you realize that your vagina is discharging abnormally, you don't sit at home and start your own treatment using the yoni pills, the boric acid, and buying your own medicines from the pharmacist to treat it. You are to go to the hospital, and then the necessary lab tests will be done on you, and then the correct treatment will be given. And we are to follow prescribed treatment fully. Some of us, it's a habit. When we start our treatment, we stop halfway, we don't finish it, and then because maybe a day or two we are fine, we leave the drugs or the medicines prescribed for us, and then that's it until something else pop up, and then we continue. No, we are to follow the treatment fully. If it is 7 days, you are supposed to finish it up. And then we should avoid sharing medicine with others. Yes, Ama and Abina cannot share the same medicine because our body mechanisms or our body um inbuilt or how we are built is different from each other. Whatever bacteria or um whatever bacteria is causing the white or gonorrhea or whatever is may be different from Ama's own. So you are not supposed to share the medicine that is given to Ama at the hospital. You have to go for your own as well. We should also encourage sexual partners to get tested. Yes. When we realize that we are having any of the STIs, that is sexually transmitted infections or the diseases, we are supposed to go with our partners. Most of the times, we see only the women or the ladies coming for treatment. Mind you, that when you start treatment and then you still continue to have sex with the same person, you will have recurrent infections. You will have recurrent infections. You are supposed to go with your partner so that he or she is also put on treatment. Now, the prevention tips. As we all know, prevention is better than cure. But the sad reality is many women spend more money treating infections than they would if they simply practice healthy habits. Let's think about our body like a garden. If you give water at the right proportion, give it sunlight, and protect it from weeds, it flourishes. Is that not it? But if we neglect it or put all the harmful chemicals, it withers. The same way, our body needs simple daily habits to stay healthy. So let's talk about the healthy ways to prevent abnormal whites. Wash vulva with clean water. Yes, we have already learned from the first speaker that the vagina already is self-cleansing. So when we are bathing, we are just supposed to wash the vulva. The vulva is the outer, what we see, the labia majora, and those two folds there. Those who are not medics will not understand the majora and then the co. So the two folds there, you are just supposed to wash that place with enough water. The inside one is the vagina. What is inside is the vagina, and we can't see that one. So the vulva is what we can see outside. We just clean it with water. We should wear breathable cotton underwear. Yes. Sometimes when we are home, you can just decide not to put on anything so that at least the vagina too can have some fresh air. Our panties, our undies, our shoe all be made of cotton, not the nylon and the synthetic ones. Yeah, this one. Avoid douching or inserting substances. It's just like a hype now, like Snapchat and TikTok. You see people selling all kinds of substances like yoni pills. I've heard of it, but I haven't seen it before. Most ladies use it. And then the hype one about boric acid. Some said it's tighten the vagina, make it fresh, smell good. Why? The vagina, is it a human being? It's already self-cleansing. So let's allow our vaginas to breathe. We should stop inserting all kinds of things. Some even insert garlic. Yes. I read on some platform that women insert garlic so that the vagina will get tightened. We are hurting ourselves and introducing all kinds of chemicals and other foreign things into the vagina, which may go a long way to cause harm to us. Change pads regularly. So when we are menstruating, especially with the ladies, if you know you flow heavy when you're stepping out or you're going to work, at least put in another pad in your bag. It should, once you are heavy and you realize that the pad is full, you're just supposed to change it. Don't wear one pad the whole day that when you get back home you have to change it all that. No, it may also cause this fight we are talking about. And then practice safe sex. Yes, as a preventiveness, we always educate or always encourage our clients or the masses that we should practice safe sex. That is, if you are not certain about your partner, are supposed to use condoms. You are supposed to use condoms and don't have multiple sexual partners. The role of health education as a preventive health nurse, my job is to educate the people so that they can learn, unlearn, and then relearn all the things that they have known in their lives. For the community, we go on home visits, we do school health, and then we educate the school children. Mine is the adolescents. We talk to them a lot about how to take care of themselves and then prevent all the sexually transmitted infections. And then women's group, all the least chance we have, we should educate the people on how to prevent this sexually transmitted disease or infections like the chlamydia, the gonorrhea, and the likes. And then they should be able to differentiate what is the normal vaginal discharge and then the abnormal ones. Include men and boys in our discussions. Yes, most of the times we are only concentrating on the girls or the women. We should also include the men also in our discussions. And then we spread awareness like what we are doing now. RTC, it's a big platform. We should continue to do this so that everyone will learn about it. We should know that not all discharge is abnormal. Some are actually healthy, like what my first speaker has said. And then for changes that cause discomfort, let's seek medical care. Let's go to the hospital as early as possible. Don't be at home and be treating yourself, buying your own drugs at the pharmacy and then treating yourself. And let's desist from the uni pills. The vagina is already cleansing, it's self-cleansing. Just use the normal water, wash it very well, the outer part that we see. And then you can also practice casual exercise. It's also good for we the ladies, in the sense that we want to tighten the vagina and all that. Instead of us buying the boric acids, the yoni pills, and the feminine wash. I don't know how that they are all full of chemicals. And then you hear ladies using feminine words to make the place nice and smelling good and all that. And let's eat all the balanced diet, fruits, drink lots of water, and also exercise so that our vagina can be very healthy. Thank you.
Thank you very much, Miss Betty. So yes, we've come to the end of the presentation, and yes, my teachers are they are really done well. So please let's show love by sending emoji. You can share it with the chat box or you can also react. Please, I'm waiting. Let's show love. Let's show love. So yes, mommy, I'll come back to you. The list of chat box and it's for personal. Miss Elizabeth Nemo is asking that is it good to use warm water with salt to wash the vagina? She's talking about not hot water but warm water. Is it good to use warm water to wash the vagina? Hello, First Lady.
Presentation. Okay, so the warm water with the local salt.
Like in general, I think you just use warm water. Wait, can you start with the salt? I think the
Not
local
really.
salt.
Oh, okay. Maybe let me just give my little maybe other medics to put in. For the warm water with the local salt, for me, I don't see it as harmful because even the local salt, we use it for other purposes. So for the local salt, it's not something that is harmful. We can just pour a little in the warm water. Maybe sometimes you use some soaps to bath and you feel like you are kind of itchy or the place feel you feel discomfort. You can just pour a little of it in warm water and then use it to just wash your vulva, not necessarily introducing it into your vagina. And I've seen a question too. Someone said whether you can insert your fingers into your vagina whilst menstruating. Why would you do that? When you are menstruating, you see all the blood and other things coming out. When you are done, the vagina itself is self-cleansing. It will cleanse it and then bring out everything out. So after you are done with menses, a day or two, realize that everything is fine. So just take in more water, eat fruits, and then do little exercise and you'll be fine. Don't be introducing your fingers into your vagina because you may introduce other bacteria or other foreign substances into the vagina, which may cause different things altogether.
Okay, okay. Thank you very much. Thank you very much, Mrs. So, Mami, please, you have the floor. Can you ask your question?
Okay, please. I wanted to ask that when Priscilla was presenting, she said that high blood glucose is a predisposing factor for candidiasis. So my question is, with patients that present with diabetes, do they develop candidiasis?
Hello, Priscilla, you have a question? Oh, I think she's not on the call. So, Miss Betty, can you answer it for us? Okay, Priscilla, you have a question. Miss Mami, can you
Yes,
give me
I'm
one?
so sorry. I got disconnected.
Oh, no problem.
Um,
Um,
Miss Mami,
can I get the question again?
ask the question.
I was asking that since high blood glucose is a predisposing factor for candidiasis, and in patients who present with diabetes, do they all get candidiasis?
Okay, thank you, Mamisi, for that question. Um, so not every diabetic patient will get candidiasis. The issue is if their glucose levels are not well controlled. That is when they will have some of these complications. But if they are taking their medications as they should, I believe their blood sugar will be well regulated, and then they'll be fine. Yes, without having those complications. Yes, but their condition is a predisposing factor. But when it is well managed, they'll be fine. Yes, not every one of them will have the infection at the end of the day. I hope I've answered your question.
Yes, please. Thank you.
Thank you.
Thank you, Priscilla. So there is another question. Why should we wear cotton underwear? Why should we wear cotton underwear?
Okay. Okay,
So in honesty,
okay. Etana, would you like to take this? Okay, let me go ahead. So with the fabric, if you know how cotton and then the other let's compare it to nylon or other those slippery materials, silk. If you know how they look, cotton usually has breathe pores, so it allows air and all of that. But you see, these silk and nylon materials, they usually trap heat because they are closely knitted. If you look at how the fabric is, again, your cotton underwear usually they are comfortable. They are, how should I say, they are soft on the skin. They do not trap heat. That's two. So we advise that you use those, and then air penetration with these cotton underwear is better than in the silk and other materials where they are closely knitted that air cannot easily penetrate. Yes. I hope I've answered your question.
okay, thank you. Is there any question again or contribution? All contributions and questions are warmly welcome. You can raise your hand or type it in the chat.
Okay. Hello, Mary.
Yeah, Dr.
Yes. I saw a question in the chat box and I would like to just answer it before we continue.
Okay.
So the question was, is it good to insert your fingers inside your vagina to wash it well, especially during your menses? So to answer this, what I would say is when you are taking your bath and you want to wash down there, you can use your hand to wash the place. But your consent shouldn't be to go as deep as possible to bring whatever out. Like I have explained, even if it is during your menstruation, everything will come out as it should. So as your flow is coming, it will be coming out as you progress in the cycle. I hope I'm making sense. So whatever is there, deep in there, will come out eventually. You don't have to dig deep into the place to bring everything out. You can do the barest minimum, just wash the place, especially the front. As far as you can see, you don't have to take your hand deep in there to bring everything out. Just the outside part, just washing these dead skin cells and everything, or the discharge that has come out, you're just washing it off so that the others can also follow. You don't have to do too much. The vagina can take care of all of that. Yes. I hope I've answered your question.
Okay, thank you, Priscilla. So there is
Okay.
another question. But before that, Dr. Benedicta, you raised your hand, so you can have the floor.
All right. Thank you so much. Excuse me. Hello, can I be heard?
Yes, please.
Yes, you can.
All right. So thank you so much to the our stars for today, Mary. I think I have to put this one off. I'm so sorry. Um, all right. All right. So thank you so much. Thank you once again, our stars for today. Thank you, Mary. Thank you, Priscilla, and thank you, Betty. Super good presentations. I would like to add a few of I would like to ask a few things and then some of the questions which were asked. I think someone asked whether salt water is good for washing down there or washing your vulva. It is as we have said that the vagina is self-cleansing. So if you are to use salt water, what is the indication? Why are you using it? Most of the time, when you want to apply something to your body, use something on your body, always ask why. And we get the notion or the point that a lot of people will like medications. Like when someone comes to the hospital and you tell them that, oh, just eat well, take care of your body. They don't like it until you give them medication. So we are usually prone to applying something to ourselves because we think normal water is not enough, or we think that just eating well is not enough. So many times we want to add something extra. The salt water, through my education and interacting with my senior colleagues, going to the clinics, I have never prescribed salt water for someone to use to cleanse, her vagina or her vulva. If there's a new development, perhaps I'm not aware of, but the usual water, clean water is okay for you. Unless maybe a health professional, you went to a gynecologist, and based on your condition, he prescribes that add salt to your water, and that one there'll be an indication. But if you are there, there's no, you don't have anything disturbing you, you don't have any infection, any discharge, don't put salts in your water. As I said, we usually want to add something, we want to do something extra, thinking that the extra that we do is going to help us. But many times, the extra that we do is the one which harms us. So for your vagina, your vulva area, if there is no indication, if a hospital, a health professional, gynecologist has not told you that because of your condition, use water or salt, please don't use it. If there's an infection, you have some itchiness, come, we'll give you medications, you have yourself treated. But do not say a friend said you can add, you can, search on Google. Google can give you many things. But at the end of the day, they also have sites. Some of them are trusted, some of them are not trusted. So from my point of view, I would say that just use the water, don't add salt unless a health professional says it. If a health professional says it, based on his training, perhaps he knows why he's telling you to do so. So if a health professional says no, please don't do it. And we are talking about vaginal discharge. The how do I say it? You wouldn't understand or you wouldn't know the severity or the dangers of not treating the vaginal discharge until you come to the hospital and you are looking for a baby, and then we'll tell you to go and do some tests, and we tell you that your tubes are blocked. I'm sure as women, when we're going to school, you know what your fallopian tubes are, you know what your uterus are. Your fallopian tubes will guide your eggs into your ovaries, and then a sperm will come and then will fertilize it, and then you have a baby. The danger with not treating vaginal discharge and vaginal infection is that it can go up, it can block your tubes, and then you will not be able to have a child. And so, if you have a vaginal discharge, you think it's uncommon, you think this one is not normal, this one is disturbing me, don't ask someone to give you some medications. Don't go and use any acid. Don't go and sit in any water. Don't go and put things under there. Go to the hospital, we'll give you treatment. Some of the treatments will tell you to take it for 2 weeks. Please take all of them. Don't say, oh, discharge, it has gone down, so I'm not taking it again. Most people will come to the hospital. I said it in our communication that when we go to the gynae clinic, the vaginal discharge is one of the most common complaints that people bring. It's either they are having vaginal discharge, or they are not seeing their menses well, or they are looking for a baby. Right, so that's some of the common complaints you hear from women when they come to the gynae clinic. And so because of the severity of vaginal discharge, you see, when you're having it, you may not think it's severe, right? It's just some discharge that comes. And it is sometimes it's not even painful. Sometimes it's just the smell. So some people just ignore it, and some people they don't treat it well. So they will treat it. You come to the hospital, we'll give you medications. They'll take it for just a few days, and then thinking that they are fine, they will not take the medication again, and then they go. In few weeks, months to come, the discharge comes again or the infection comes again, and then it becomes recurrent. Those ones are very dangerous because as they are becoming recurrent, you know that it's not gone, it's still there. And so those ones can climb high up. They can cause, upward infection, upward ascension, ascend upwards, block your tubes or infect your tubes and then block them, right? And when these tubes are blocked, there's no way you're going to give birth again, through the natural process. You have to do IVF, and you know how difficult, how expensive IVFs are. So my two main advice that I'll give all of us here. The first one, do not insert anything foreign into your vagina. Even the cleansing that we are talking about, your vagina, you can't see your vagina. What you see is the vulva. You have to put your hand inside, and putting your hand inside, sometimes you may not even see clearly. If you don't take care, you harm yourself. So don't put your hand inside. Don't insert anything inside. You just clean the outward part. The inner part, it will clean itself. It will cleanse itself. So do not put anything foreign. Just use water. Even soap, you have to be careful. Don't put soap inward. You just clean with water. So you use soap and sponge, you bath yourself and all of that. When it reaches down there, you want to clean your vagina, you just take water, your hand, which you have cleaned, obviously bathing, and then you wash that area. That is all. That is all that you need for your vagina. And then, so don't use any foreign material. So that is all. The second advice I'll give you is once you see something abnormal, once you see something unusual, let's say discharge, itching, rash, you make sure that you come. Some of the discharges, some of the itching, and then the rash may be pointers to some even severe disease that we may have to find out. So please come to the hospital, see a health professional. Many times we don't just treat blindly. We do something called HVS, high vaginal swab. We'll take a swab so that we can get the actual organism causing the infection, and we can treat you accordingly. So don't joke with your vaginal health. Don't joke with your vaginal care, because you may see that, oh, it's normal, I'm just using it. But I told you the severe complication which many women fear, and it becomes very destructive to many women because we are in a very local setting, especially in Ghana. And as a woman, if you don't give birth, I mean, it's a big deal. You always have backlash and all. So whenever you are thinking of vaginal discharge, vaginal something, think about your fertility. It can easily affect your fertility. So the discharge that you'll be playing with, oh, I am inserting this, I am going to buy this that you'll be playing with, you wouldn't know. In future, when you're looking for a child, you've not done anything before, you've not done this, and then you start asking questions, what happened, what happened, what happened? And then you do a test called HSG, and then we realize that, oh, your tubes are blocked. You didn't have an ectopic, you didn't have this. What could be the possible cause? It's likely that you may have had an infection, it wasn't treated well, and it's blocked your tube. So these are my two main, tips for you. Please be careful. Don't put anything there. If there is anything abnormal, seek expert opinion. If the expert gives you treatment regimen, please follow it to the core because your fertility is also at risk. Thank you.
Thank you very, very much, Dr. Benedicta. So, Isabella, I hope your question has been answered, or you have an additional one. Kindly let me know if you have a follow-up question or you are okay with it. So, moving on, we have a question from Josephine Bidiako. She's asking that, can we take probiotics, specifically the ones containing lactobacillus, to balance the flora of the vagina? So, Priscilla, you presented on that one, but Betty, you can answer if you are also here. So, hello. Okay, thank you very much, Isabella. So, yes, the question, is it okay to take probiotics containing lactobacillus to balance the flora of the vagina? Hello, Priscilla. Hello, Betty.
I'm here. Okay, so to answer,
Okay.
please can I be heard? Hello.
Hello.
Okay, so to answer her question, she's saying, is it right to take probiotics containing lactobacillus? Okay, so the vaginal flora is actually made of this particular bacteria. The good bacteria I was mentioning is actually lactobacillus. So, in a normal state, the vagina is balanced and all of that. The lactobacillus is there as it should be in the right proportions and in the right amount just to protect you from any infection. However, if like Dr. Benedicta said, a health professional thinks that you need this additional protection and hence prescribes this probiotic to you to use, then you can go ahead to use it. But on your own, you wouldn't have to go in for that because already you have lactobacillus in your vaginal flora doing the work already. So you don't have to go in for more or in an attempt to come and balance it or to keep the place clean or healthy, whatever. But in its normal state, it is good. But if there should be an infection or there's a problem and a health professional advises that you should go in for that to augment or help what the body is already doing, then you can go ahead because it is the same bacteria down there that is in this probiotic that you mentioned. Yes. So that's what I have to say. I hope I've answered your question. Thank you.
Okay, thank you. Hello, Josephine. I hope your question has been answered. Kindly let me know if you are okay with this or if you have a follow-up question.
Hello, good evening.
Yeah, good evening.
Hello. Good evening.
Hello.
Okay. Hello. Hello.
Yeah. Hello,
Okay.
you are
So,
ahead, please.
yeah. So I wanted to say, okay, I don't know, but for probiotics, it's like how do okay, I don't know. But I feel like although we have the lactobacillus, because of the way the things that we are eating, the way our environment and all those things, we are more likely to have an imbalance sometimes. So most of the time, I advise my patients that even if they don't have anything going on, once in a while, they should take in probiotics because these things are good. I feel like you can never have an overdose of probiotics, even for our guts. We encourage people that they should take in some gut flora once in a while, especially if you are someone who suffer from vaginal infections. We advise them that once in a while because we keep on taking a lot of antibiotics, and the more we are taking these antibiotics, they keep on killing all these good good bacteria. So it's important that we replace them. There are some of them that I even have to advise that anytime they are done taking antibiotics, they should be intentional about taking probiotics. It should be something that they should be regularly taken because of the antibiotics we take, because of the medication that we, food that we take, and the environment. So for me, I believe that apart from a healthcare professional prescribing it, it can be something. It's like how we go for nutraceuticals. You don't always need someone to tell you that, oh, maybe you should go and take some well woman or something. If you feel like you can afford it and you want to just just improve your immune system or your skin or whatever, just to help you, you can just go and buy. You don't always, those things are like over the counter medication. You don't need to be prescribed before you take them. So that's what I'm saying.
Okay. Dr. Just we not go yet. So I have a question. At what point can one stop taking that one? Or is it like you can take it like folic acid that you take every day?
So you don't have to take it every single day, but once in a while you can take it. It's like how, just as you are using the folic acid as an example, it's something that is already inside our body. We can never take well, sometimes you can't have an overdose, but you can never have an overdose of like a folic acid because of the blood that we lose every day, and we keep on taking medication, and we keep on, the blood we keep on losing. It's important that we take the folic. So it's like it's a good thing for our body, although we already have it because of the medications, because of the food and the other things that are involved. We kind of lose those good things. So it's important that we are intentional in taking them. You don't have to take them every day, but you can be intentional about taking them sometimes.
All right. Thank you very much for your contribution.
And I also have another question.
Okay, you can go on.
So my question is, so I had a woman who came to me and she was complaining of having discomfort at the vagina. And she had gone to the hospital, they were giving her some antibiotics, they did tests, a lot of things. And um for me, I think from what she was saying, I believe it was her underwear, like the panties that she was wearing. So I want to ask, how do we go about taking care of our panties? For me, I told her that since, because she feels like when I don't know whether it's an African thing or something, but we don't hang our pants outside for sun to like touch on it or dry it, because like pants are supposed to be in the inside. It's not supposed to be outside for people to see. So the sun doesn't get to it. And sometimes because of that, it can hold a lot of microorganisms. So for me, I advise her that she should use panty liners. But I want to know, is there any way that we can take better care of our panties? Do we need to use harsh chemicals, or we should just use mild detergent? And is this necessary for us to make sure that the sun dries up, or we can iron it? Like, I want to know how we take care of our panties and our underwears.
Okay, thank you. So yes, Miss Betty and Miss Priscilla, there is a question on board. But before they come in, I want to say something small. The best option is to dry our panties in the sunlight. But most people, I don't know, yes, as you said, African culture, they are shy, or sometimes they feel like the panties are not supposed to be outside. So most people dry it inside. But one thing I think they can help is by ironing the panties. I don't know, but I think that's one tip that most people have done it, and then it has really helped them. So before they wear the panties, they iron it before they wear it. So yes, that's my small contribution. So yes, Miss Betty and then Miss Priscilla, please kindly come in.
Okay, so yes, so she sort of answered her question and then you have also added up. So I believe that our panties and underwear should get direct sunlight. The heat that the exposure to sunlight will bring on these undergarments will help reduce any microorganisms that it could be hoarding. Yes, ironing will also introduce some heat, and that will help. Most of the time, like you have said, most people hang their panties indoors, so it doesn't get the sunlight it should. They can resort to ironing in such an instance where you can't do anything about it. And also, you realize most of the time people do not change their panties. Not to say that they don't change within the day, but you could use a set of panties for 3 months and over. But when you see that you have used it like so many times and actually it's not looking so good, I advise that you change, maybe get another set, change and then use. Yes. So drying in the sun, ironing, heat exposure will help. Changing changing your set of underwear over time will also help. And then you also mentioned the use of panty liners. Yeah, that one also go a long way. Yes. The only issue is sometimes the heat it traps. Yes, but if you're not using it for um long hours, or you can change as you go to the washroom during the day, you can change. That's fine. Yes, that will also go a long way to help reducing this infection. Yes, so that's the little I can add. Thank you.
Okay, so the last one, can we use parazone
Okay,
to be
thank you.
washing them?
A lot of questions.
Can we use like parazone and those hash to be washing the panties and the underwear so that is it good?
Is it the colored
Sorry.
ones or the white ones?
So
Parazone.
why it is parazone?
Yes, okay. You want to wash your pants, you could just rinse it first with warm water and then you wash it with, keep quiet. I said keep quiet with a soap or maybe, yeah, omo or whatever, and then you add small of maybe Dettol to the water. KK, stop, I'm online. To the Dettol, and then you dry it outside in the sun. But some places too, the environment is so dusty. So in that case, you can iron your panties or use the panty liner as you have already said.
Okay, thank you.
Okay. Hello. Just to add to what Betty said. So the issue with the parazone is I don't see it to be a problem if you are going to use it to wash your white undies. At the end of the day, whatever detergent you are using to wash your underwear, make sure you are using enough water to wash out all those chemicals because parazone is very strong. So if you are going to use it in moderation one, and use a lot of water to rinse. You can even rinse it twice. Like she said, you can use warm water, then rinse again, so that you're getting all of those chemicals out. So as much as it has to do with making sure that your underwear is clean and looking good, especially with the white, you can use your detergent. But make sure that after you are done washing and you dry, you don't still have chemicals in there that are going to come into contact with your skin, your lower part. Yes, that's a little I can add. Thank you.
Hello, Dr. Jasmine. I hope you're okay now.
Yes, please, I am. Thank you.
Okay. So yes, we've come to the end of our session. Yes, time has already spent. So before that, I will invite Dr. Benedict.
The president of Great, and we have our citizens today where we have our weekly dialogue. So yes, that's what I'm saying. Hello, that's what I'm
Oh,
saying.
okay, hello. I thought I had already spoken. But anyway, thank you so much. Okay, thank you so much, Mary. And this evening we've learned quite a lot. Um, Thank you so much, Priscilla. Thank you, Betty. And thank you, those who asked questions, those who contributed, and even Dr. Josephine for also adding your voice. I think that we have learned a lot. So if we're able to practice it, we shouldn't have any problem. Right. So if I think with this one, I would have to ask Dr. Josephine herself. I have not really prescribed probiotics for my patients. If there be any probiotics, I would. It's just yogurt that, especially for our patients, some of them who have been on antibiotics for a long time and then they start complaining of diarrhea, we give them yogurt. I haven't had any aside yogurts prescribed any probiotics for my patients. So I think maybe it's either I'll ask her in chambers, I mean in her DMs, or if she can respond here. But aside that, it has been a very insightful conversation. I've learned quite a lot. And I hope those of us who join have learned a lot. It's good that you know how to take care of your reproductive health, because once you have a problem with it, the consequences are sometimes very dire, sometimes very severe. And because of the cultural aspects of it, it becomes very sad as well, especially in our society. So do well to take care of your vaginal health, do well to keep it clean, do well to not, use just anything. Keep it safe, keep it sacred. Don't just put anything, don't just take anything, don't just insert anything for inserting sake. If you go to the hospital and then you spend some small money for treatment, it's far better than in the future you spending a whole lot of money to treat, some fertility issues or treat some very bad infections. So it has been a very insightful conversation. I hope we have learned a lot, and not just learned, but then we'll make sure that we are keeping ourselves clean and we are keeping ourselves safe. So a heartfelt thank you to our speakers, Priscilla, hi, Priscilla, Auntie Betty, hi, and then Mary. We really appreciate you, the work you've put together. And some of the audience are even asking for your slides because of how good, how detailed it is, and not just, because it was detailed, but then it contains very valuable information. And we know that it didn't just come, for coming sake. You put a lot of work into it. You put a lot of effort into it. And for this, we say thank you. God bless you. And may you reap the benefits of your labor. So thank you very much. And God bless you. And may we have a wonderful evening. Over to you, Mary.
All right, all right. So thank you very, very much, my speakers. You really done well. So they are linked in. So my people, if you want to connect with them, we have Priscilla Amageshi, Daniel, and also Miss Betty Etona. You can connect with them on LinkedIn, and also if you have any collaboration. And to my audience, I appreciate all of you for coming. Thank you very much for your time and then your contribution and questions. This session has really been insightful. So we've come to the end of it, but before that, let's have a word of prayer. We thank you, our most gracious Father, for being with us throughout the session. We pray that you come and help us and also be with us so that whatever that we've learned, we will practice it and also share it with others in order for us to live a healthy life. Be with us in Jesus' name. Amen. So my people, as we have learned this, let's keep it to ourselves, but also share it with our friends, our sisters, and then our family. Wishing you all a blessed day. Do enjoy your day. Bye.
Thanks. Bye-bye. Thank you,
Bye-bye.
Thank you
Bye.
all for joining.
Bye.